Hi, my name is Mica Phillips, and this is My Aeroflow Story. I spent all of my 20s basically floating through different hospitality jobs. And ironically, I responded to an ad for a job which, I was just truly applying for one out of many different jobs, just going, I guess that's something I can do. They made the decision to hire me and bring me on to a direct patient care role in the sleep division, talking, to patients and saying, hey, would you like to get your new CPAP supplies for this month? Went home after a couple of trainings, and I actually said to my wife, honey, I think I'm actually going to take some other job interviews. I don't know if this job is for me. What was funny, and one of the things I remember about my early days here was I had some ideas on how I thought the process could be better, how I thought calls could be handled more efficiently. And I remember saying those to my manager. My ideas somehow got laddered up to Josh Hill, who is our vice president. He stopped by one day and he said, hey, I heard you have some ideas on how to make things better. I'm going to get you to sit with Casey. And I said, oh, okay, cool. Who's Casey? And he said, oh, he's the owner of the company. And I was like, this company's weird. But I actually had an opportunity to go sit with Casey and say, hey, I think if we did this, I think people could field a lot more calls and we could provide better patient care. And Casey pressed a couple buttons, and I was just like, wow, that is kind of an incredible feeling. Honestly, that very small thing was one of the things that helped identify me as being able to move into leading up the urology division when I had no real formal qualifications to do that. One of the greatest things we do as a company is to crowdsource ideas from our staff and put them into practice. We have an idea, and a lot of times we just do it. It keeps you motivated, keeps you hungry, keeps you innovative and looking to do things differently and better. We have over now 15,000 Google reviews on our Aeroflow Urology page with a 4.9 star average. We are limited sometimes by working with insurance, but the thing that I'm proudest of is that we take a really unconventional look toward understanding the limitations we have. How do we provide the best service to patients that we possibly can? And even if we can't meet their exact need, how do we be as clear and transparent as possible in explaining why that is and trying to find some kind of a solution for them? People are telling deeply personal stories about the benefit that they've seen for their child with a disability, for them as a housebound adult with a medical disability. We're looking out for a segment of the population that gets left behind a lot of the time. Doing that consistently is one of the things that I'm proudest of.